I wanted to talk about my experience with what I am going to call healing therapy and what a lot of transgender activists are calling conversion therapy. And they're calling it conversion therapy in order to take advantage of the negative connotations that term has in regard to reparative therapy for gays. But in the case of transgender people, it's totally different. What they're saying is conversion therapy isn't conversion therapy. It's a healing therapy. And I know this because when I was a kid, I was trans. Thankfully, my school psychologist didn't affirm my transgender identity. Instead, she put together a very simple plan for my parents and teachers to help put me on a path towards healing, a path towards accepting myself as a female, a path towards loving myself rather than hating myself, and a path towards accepting myself. These very simple things included putting me in Girl Scouts so that I could be around other girls. They included putting me in a communications class because I had a difficult time communicating and I had some issues with anger. It included not affirming me and encouraging me to dress in a more feminine way. Again, not mandating it, but encouraging it. And it also involved giving me examples of strong women so that I could learn that being a female didn't mean I was vulnerable. What a lot of people don't understand is that there are children like me that develop gender dysphoria as a result of an underlying issue. In my case, it was the result of a sexual assault. If I had been affirmed in my transgender identity, I never would have understood the connection between what happened. I never would have realized that my transgender identity was a coping mechanism rather than a true identity. And this is true with so many kids. In fact, some studies show that up to 90% of kids who have gender identity issues are actually autistic or on the autism spectrum or have other underlying mental health issues. One of the things that happens when you affirm a child's identity as trans is that you encourage them to dislike who they are. You encourage them to believe that they're born in the wrong body. You encourage them to believe that there's something inherently wrong with their body. This reinforces any negative beliefs they already have about themselves, and it denies them the opportunity to identify the underlying issue that's causing their gender dysphoria and their belief that they're transgender. The other problem is that children who are affirmed are more likely to seek medical interventions. Oftentimes, trans activists talk about medical interventions such as puberty blockers as no big deal. Puberty blockers merely prevent a person from going through puberty so that they have some time to think about it. But what they don't tell you is that 90 to 100% of children who are allowed to naturally progress through puberty without having their trans identity affirmed actually have their gender dysphoria resolved, which means they're prescribing a very potent medication to put off puberty. And yet it is puberty that is the solution to the gender dysphoria. Puberty actually cures so many children of their trans identity. So by putting a child on puberty blockers, you are actually preventing them from healing. I can't think of any other case where medical care providers are actually encouraging people to take medical treatment that will cause them to not heal from whatever it is that causes their distress. Now, it would be one thing if transgender children grew up and were perfectly happy and healthy and functional, but they're not. The medications that they're put in cause their bodies to become permanently dysfunctional, and it's basically embracing the idea that there's something inherently wrong with them. And there's really no way to be a happy person if you believe there's something inherently wrong with who you are, that you were born in the wrong body. In addition, studies have shown that transgendered adults have huge rates of suicide, suicidality, self-harm, and other mental health issues. Now, trans activists will say this is because they're not affirmed. But the fact is that as we've started to affirm children, as we've started to be more accepting and embracing of trans identities, these rates have gone up, not down. If it was true that someone was going to kill themselves if their identity was not affirmed, we would have seen suicide rates going down as we've instituted treatments and policies that affirmed transgender identities, but instead we've seen the opposite. So where were all these suicides when our society wasn't affirming transgender identity? Why is it that I didn't kill myself? Because I wasn't affirmed. I certainly wasn't affirmed. In fact, my parents and my teachers worked towards helping me to resolve my gender dysphoria. I had therapists who helped put me on a path towards healing. What banning conversion therapy does is it prevents gender dysphoric children like I was from getting appropriate health care. It prevents them from being put on a path towards healing. What you're actually doing is banning healing therapy. When you hear about bans on conversion therapy, please understand what these bans are. What they are is they are banning mental health care providers from helping those who have gender dysphoria as a result of an underlying issue. These bans require therapists to affirm the gender dysphoria in a child and to push them towards medical transitioning, which will cause their functional body to become dysfunctional and will lead them away from a normal and natural healing process in puberty.